Welcome everyone to this week's edition of Health Corner. Today we're talking about nutrition and weight loss from a plastic surgeon's perspective. Today we have the pleasure to invite a consultant plastic surgeon, Mr. Fortune Iwagu. Mr. Iwagu, welcome to Health Corner.
Oh, thank you very much. Thanks for having me.
Yes, we have a lot of communities, and the ethnic mix in our area is very clear. One of the things they like to hear, especially from someone from where they come from, is around dieting. They don't have anyone to speak to them, obviously. Thank you for coming. When we talk about diets from the BAME perspective, I know you see a lot of Africans, you see a lot of Asians, you see a lot of other ethnic minority groups. What will be the advice around what they eat? Should they be eating high carbohydrate or high starch food, or should it be a mix, and what times of the day? It's a huge topic, but I know that if you can just tell us from your perspective what you think they should think about when they want to eat. Yes, I think that will really help, just for a start.
Yeah, as I said, thank you for having me. I think of it in terms of not diet, but nutrition.
Yes.
So there are three essential components to any good food. You need fat, you need carbohydrates, and you need protein.
Yeah.
I know there's so much about diet, diet this and diet this. And the reason I don't go the way of diet is that when people go on a diet, they avoid certain things for a temporary period. And what happens after that period passes, they go back to what they normally eat, and put on the whole weight back.
Right.
So I look at it from a nutritional perspective. And for people who are of the ethnic minorities, the black people and the Asians, it is very clear when we look at the foods that we do eat.
Yes.
It is very high in calorific value. Just imagine something like palm oil. Yes. What it contains. Fufu, gari, amala, pounded yam.
Yeah.
It's a high starch content. This is something we've been used to having over the centuries, and that's what we eat. With the Asians, the same thing. They have ghee in their food, things like this. So there's a lot, and really some Asians, most of their food is based on carbohydrate, like rice. And then what happens is that for every man and every woman, there's an amount that is expected you should take in a particular day.
Okay.
And the arithmetic to weight loss is output versus input. If the input is more than the output, the person will put on weight. If the output is more, the person will lose weight.
Yes.
But when you take a diet, or you take foods that are high, have lots of calories. They may be small in amount, but they carry a lot of calories. It's easy for someone to exceed what is expected of them for that day, and they put on weight. So for our people of these ethnic minorities, I'm not asking anyone to stop eating any particular food because I'm not a nutritionist.
Yes.
But from what I see from my perspective, it is a balance. Now, as we discussed earlier, most people from ethnic minorities don't have any measurement like say, okay, this bowl of gari has this amount of calories or this amount of calories.
Yeah.
But the way I look at it for people is, when do you have most activity? Usually during the day.
Yeah.
For somebody to spend all day starving themselves, and then to take a massive bowl of fufu or pounded yam in the night, what do they do after eating that? They go to sleep.
Yes.
No more activity. So that bowl of fufu and all the nutritious or whatever, nutritive, whatever you can call it, very delicious soup they've had with that, probably has already exceeded what they're supposed to take in a day. And then there's no more activity after that, they go to bed. So that has problems. But if they take a smaller amount during the day, as they are walking about, getting on their normal life or normal daily activities, they're likely to burn off some of the calories.
Yeah.
You know, so the way I look at weight loss from a plastic surgery perspective is you have to start from the head down. There has to be a perfect marriage between mindset, nutrition, and activity.
Yes.
If any of them, if there's a problem, if any of them is a weak link, the whole thing will fall apart.
Right.
And why do I say mindset? I mean, years ago, I remember treating somebody who's actually a black person who came, who had children, a lady in her 40s. And she came to have a tummy tuck, an arm reduction, and a thigh reduction. But when she checked all that, she could only afford one thing. She said, do my thighs. But you see, when you do surgery, you follow these people months down the line. So we did just reduce the thighs by liposuction and some excision, and she was pleased. Then when I saw her 6 months down the line, immediately she walked into the room. I said, you're a fraction of the woman you used to be. So what happened? Now it does appear that when she checked it, she thought about it, she said, I made up my mind to reduce my weight.
Yeah.
Because already she was beginning to get some joint pains. You know, that goes to what are the benefits of somebody actually losing weight?
Yes.
Joint pains. And what did she do? She started walking. Every day started walking. She started from half a mile to a mile.
Yeah.
By the time she came to see me, she was doing about 7 to 8 miles every day.
Right.
That's not even registering in a gym. And the weight the weight just came off her.
Right.
And you could see when she came, her skin glowed. Everything was so different about the person. So for the way I look at it, for our people, this is very important for them to look into this.
Yeah.
We can't just eat anything
Yes.
and not have an active lifestyle and expect the weight just to come off.
And
Even though I'm a surgeon, I would say this. Surgery, there's a place for surgery.
yeah.
But if we can try and prevent in the first place, prevention is better than cure, as they say. You know, at least even if you do have surgery, you have the amount of surgery, the extent of the surgery much less. So that's really the way I approach it.
That is very good. And I know you mentioned in the past things around palm oil, coconut oil, groundnut oil. Which of the oils? Well, olive oil. I know a lot of people tend to connect to eating the less saturated oil. But I know the African community, I don't know about the Asians, but which of the oil would you advise that they eat more?
Well, generally, medically, they say olive oil, which is not traditional to us. Most people from the African community, Asian community, usually use palm oil or coconut oil or vegetable oil. So I would say, in my own opinion, the coconut oil, everything is moderation. Everything has moderation because there are certain nutrients, like the amino acids. Amino acids is the when you break down protein, that is called the amino acid. There are certain ones you only have in palm oil, which is useful. So palm oil is not totally bad, but everything is in moderation. You know, coconut oil as well is said to be so good because apart from actually bringing calories, it's actually able to go through the blood-brain barrier. You know, the brain uses things like sugar, and coconut oil is able to be converted into something that the brain can use. There are studies going on, people using it for people who have like memory issues, and even somebody if it has some cancer properties, anti-cancer properties. So I don't want to say anything bad against any oil, but it has to be in moderation and prepared properly. That's the way I look. That's the way I look at it. I don't want to take the.
I know.
I'm not going into nutrition because that's not my forte.
No, thank you for that. That's very informative. You know, the audience, I mean, someone watching this will say, okay, they have their traditional food. They have the pounded yam, they have gari, they have the Asian, they have the different starchy food. Now we'll talk about moderation. will it be a good idea to ask them to eat this food in the morning or in the afternoon, or what time of the day, or what quantity? I know everyone is different. What would be your advice?
I think definitely most of the very starchy food or the heavy food shouldn't be at night.
Yeah. Okay.
Because more activity is reduced at night. So it has to be sometime between morning and afternoon. That's my take on it.
Okay.
In fact, they say you should eat like a king. Your breakfast should be like a king.
Yes.
You know,
Yeah.
and then your dinner, your supper should be like a pauper.
Yeah.
So the lighter foods, I think, is for the evening. Because actually, if you eat heavy foods at night, it affects somebody's sleep.
Yes.
It can cause a reflux where people at night they begin to choke. Food begins to come back.
Break up acid, is it?
Brings up acid from the stomach. So I think it is better in the morning and the afternoon. That's why I would take it. That's best time. But it's moderation is still the issue.
Yes. Okay. And do you advise people to cook their food or to? Well, a lot of people rely on takeaways.
No. I think there's a place for everything in life. I think the focus should be for people to prepare their food.
Yeah.
It has to be for them to prepare their food. You know, there are people who go to some of the shops and buy already prepared food. And how do they make this already prepared food tasty? We know that the thing that gives food palatability is the fat content.
Yes.
Most kinds of food is fat. That's what it does. So most of these kind of things they buy had so much fat in it. Though they take that home, then they add if it's like people, most are people from Africa, maybe West Africa, or is it they go and buy one form of soup, like a goosey soup, or okra soup, or vegetable soup, and then they go home, then they prepare pounded yam. So they have a pyramid of pounded yam, and then soup that has so much calories in it, from that, it is not can be healthy.
Right.
But because if somebody prepares it themselves, they're able then to tailor the different components of the food, the fat, the starch, the protein, to what is actually good for them.
Yes. And, you know, the ethnic minorities, they all like to socialize. It's part of our life anyway. We know how, whether we're African or Asian or any of the people go to occasions.
That's right.
What is your advice about alcohol? I mean, obviously they eat and then they drink, obviously.
We have to understand something about alcohol. Alcohol has a lot of calories in it.
Yeah.
You know, there are people who wouldn't eat. You see some people say they won't eat, they're just having alcohol. They think they're just drinking.
Yeah.
The alcohol, they need to just check some of the bottles. A bottle of some of these alcoholic drinks has 200, 300 calories in it. So you have two of it, that's 600 already you have taken. And you still be feeling hungry, you know. So, I mean, apart from the social negativities concerning alcohol, in terms of nutrition, it still has to be the word. For me, the key word is moderation.
Yes.
You know, if somebody is going to go to something like that, a little bit of alcohol may be acceptable. But to take anything in excess is never good.
Yes.
And the fact that it's an occasion, not why the person to drink themselves to stupor.
Apart
from that, not just the alcoholic drinks, some of the fizzy drinks have so much sugar in them. Not sugar, and also other kinds of stuff that is put in it, maybe the colorings. Some of them are actually being shown to cause have been shown to be carcinogenic. In other words, they encourage the development of cancer. So I would say the best drink in the world is water. However, you can't just, there are people, I mean, you can't say somebody only drink water all your life if you like all the drinks, but take a little bit of everything and be careful.
Yeah, that's fantastic. Some cultures say they don't smoke, but they chew tobacco. I know some cultures that chew tobacco and end up with mouth cancers. Yes. Will you, obviously, from the cause, well, we'll call it the causal link, chew tobacco, end up with cancer, smoke, and then will you advise people to, smoke in moderation or not to smoke at all?
Well, I don't think there's any advantage that's been shown medically that smoke gives to anyone. Smoking.
Yeah.
maybe it's going to be shown in the future that people say it makes them relax. So I think medically speaking, this is from purely from a medical perspective, the smoking cigarettes or this has not been shown to be of any advantage to anyone. I mean, one of the things that what is contained in tobacco, one of the things it does to the vessels, that it causes spasm, which means the vessels, instead of being this wide, they shrink. So by shrinking, the blood supply to tissues is reduced. So when people have like a surgery, wound healing can be a problem. Smoking as well, when somebody smokes, it's like you're putting smoke on the face. People who smoke so much, sometimes you look at their skin, you can see what happens to the skin with smoke. So I don't think, as far as I'm aware, there is no advantage. So I'm not here to talk about smoking cessation. However, I can say that smoking categorically has not been shown to give any medical value, being of any medical value. Now, if you're also chewing tobacco, you're also smoking. The stuff that is in tobacco, you're also taking it in. I think when you alluded to people having mouth cancer, that's more like in the Asian community. When they have the betel nut, put it in line, they put it, some of them put it in their mouth and even sleep with it. And where the betel, normally where it rests, after some time they develop cancer there. That's you know, like oral cancer is quite common in some Asian communities, from this kind of practice. So.
No, that's fine. And like you said, drink in moderation. I think Public Health England has advised men to drink no more than 14 units a week and women 12. If that advice is still there. So viewers, if you're joining us, we have a consultant, plastic surgeon, Mr. Fortune Iwuagwu, who is taking us through nutrition and weight loss. I mean, that is weight loss that keeps us healthy. So we're going to take a break. When we come back for the second segment, we're going to talk more on some of the things you could do to lose weight and keep fit. Don't go away. We'll be right back. Welcome back to Health Corner for this week. I mean, this second segment will deal with what it is we can do to either lose weight if you want to lose weight or to stay healthy. Remember, we have the pleasure to listen to a consultant plastic surgeon, Mr. Fortune Iwuagwu, taking us through nutrition and weight loss from a plastic surgeon's perspective. So, Mr. Iwuagwu, you know, we talked about people eating in moderation. What we eat is very important to keep healthy. But on the other hand, a lot of people have the problem of finding it difficult to lose weight. What would be your advice to such people?
Well, as I said earlier on, that to lose weight it has to be a perfect marriage between mindset, nutrition, and activity. I think we talked about input, nutrition, things in moderation. Now, for somebody to lose weight, the simple arithmetic of input versus output has to be right. One has to reduce input and increase output. So how do they increase output? It's activity. How do you do this activity? Mindset has to be right. Somebody has to make up their mind and say, this is what I'm going to do. And I don't think actually that people need to go and join a gymnasium. It's not really that important to do that. Anyone can increase the activity on their own. For example, if you work, wherever you work, there's a car park that is maybe 500 yards from the hospital or from the company or wherever you do work. You can park your car or whatever far away from there and walk exactly to your office. That's some activity somebody's doing. People can take up things like cycling, walking. Walking, you don't pay anyone for walking. You can be listening to music. You can be listening to an audio book where somebody's walking. You can be listening to a message from somebody. And the only thing is, I say to them is, make up your mind and start small and increase. when people begin to walk, when they begin to do any form of increased activity, the brain produces these hormones called the endorphins that make them feel happier. In fact, some of them get so addicted to it that they can't let go. Every day they haven't done that form of activity, they wouldn't feel happy.
Yeah.
So I think it's what people can do is maybe just begin to increase the activity. They don't need to go and register anywhere, as I said before. Just start walking. Maybe walk a few streets, more streets, more streets. Yes. Before they know it, they're doing miles a day.
Yes.
If you want to go and buy something from the shop, instead of cycling down to the shop or taking a taxi or a bus, walk down to the shop.
And if they want to park their car, they look for the parking space that is closest to the car park, so they can park as
far away,
from, yes,
and just walk. So that then those people who can afford it, I'm not afford it. Some people who not even go to a gym, it's not that they cannot afford it; they just don't want to.
Yeah.
They think it's a waste of money. But those people who can afford it or who decide to, they go to a gymnasium. In a gymnasium, they can have a personal fitness trainer or can just do things. Most gyms now, if you go there and speak to one of the staff, they will take you through a program. So there are things that people can do, and that's for men and women that can keep doing it. Like people mention about men having pot bellies. Yes. Obviously, as one gets older, the muscle tone gets weaker unless you increase the activity. And what causes the pot belly? Apart from the fact that people have put on weight, the muscle in the front, when they say people have abs, the rectus abdominis muscle, when people say they have or six-pack or eight-pack, whatever they call it, and the other muscles around the tummy, what I call the core muscles, become weaker. So if they're weaker and they're not well toned, then the weight and the added fat makes it protrude.
Yes.
So by increasing activity, that tones it more. By reducing weight as well and increasing the activity, it looks better toned and the person has a better physique. Yes. For example, when we do surgery and you look at muscle, like you do what's called a muscle flap, when you take one muscle to another, you notice like people who do have a lot of weight, there's actually fat between the muscle fiber, so the muscle doesn't work as well.
Yes.
You see, so it's weaker. So you can see as the person loses the fat, the muscle becomes leaner and better.
Yes.
So you can even see when you buy a basic meat, which our people like a lot buying meat, some of them are very, very fatty. Those are not fatty. So somebody can see that. I think the way mindset is so important, somebody has to look at it and say, wow, what am I gaining from this? You know, excessive weight causes a lot of problems. You know, that's why all of us are working towards achieving a weight that is acceptable.
Yes.
Like if you start from somebody's head to their toes, there are functional and psychological benefits to losing excessive weight, to being within a weight that is healthy for you. The psychological benefits are quite clear. Yes. When people have the weight they're supposed to be, they feel happy, they feel healthier. Yes. There's a less incidence of depression, less incidence of low self-esteem. They can buy the kind of clothes they wear. Yes. And when they wear those clothes, they feel happy in them. The functional things also, like from the brain. There's incidence of strokes, you know, like especially in our community. Hypertension is very common amongst. Yes. So strokes are more when people are really overweight. Yes. You know, as you come down like the heart, I mentioned the heart is a muscle. The so-called heart, the heart is a muscle. It's a muscle, So when there's too much fat within the muscle fibers, the heart doesn't function well. And this fat can also line the inner lining of the blood vessels. Yes. You can sit there as well. So people have coronary artery disease, which is like disease affecting the vessel, the arteries that go to the heart. So that's a problem in itself. Even the lungs itself, people sleep apnea is more. So when people are sleeping, they suddenly wake up. It's more in overweight people. Yeah. You know, if you go down, there's certain kinds of cancers are more common in people who are, you know, even the pancreas. The pancreas is the organ in the tummy that produces insulin that lowers the blood sugar. Now, when somebody has too much fat, the fat gets changed to sugar. So it becomes too much for the body to carry. So it overwhelms the pancreas and they may come down with type 2 diabetes. So that's an issue. You know, the joints, they begin to have more and more joint pains. And even if you come to the largest organ in the body, which is actually the skin, People who have excessive weight and excessive folds of skin, maybe between their thighs and below their tummy. The skin rubs against each other.
Yes.
Causes little frictional wounds that they do have and abrasions. With the moisture combined, they develop a fungal and bacterial infection, having tetraigo. So hygiene becomes even an issue.
Yes.
There. And people, when somebody has excessive weight, when they have surgery, they're more likely to even have more problems.
Yes, recall wound healing.
Wound healing is poorer. The fat doesn't have as good blood supply as you have with the muscle. So wound healing is poorer. And they say spend more time in hospital, more complication, and then it becomes a vicious cycle.
Yes.
It's more expensive. So there's so much benefits for us, all of us, to try to watch what we eat. And these are very, very tasty food that we eat, to tailor it down, to try and achieve a weight that is healthy for us.
Yeah. And talking about exercises, if people who can't afford the gym, they can do things at home. I mean, I know some speakers have said, dancing, going.
Oh, people like dancing.
Yeah, well, exactly.
Dancing is a good thing.
Family.
Dancing is a very good form of exercise, because dancing energizes the rest, all parts of the body.
Yes.
So somebody can dance to what they actually like.
Yeah.
Dancing is one. Even all the exercises you do in the gym, without all the equipment, you can do it at home. You can do things like sit-ups. Yeah. Or somebody can actually, from Amazon, buy something like dumbbells and do the weights. If they want to do weights, they can do it at home. So it mustn't be somebody going to a gym. Swimming is another thing. Well, I guess most places have to belong to a swimming club or a gym to go to do swimming. Swimming is another thing that actually burns calories. Cycling, we already mentioned cycling. Just get a bike. Just be safe. Make sure you wear your helmet. Look for areas that are not so busy and just begin to do it. So there are so many things that our people can begin to do.
I know you mentioned people who have come for bariatric surgeries. I know if they tried, for the few where it's gone wrong, they are not able to lose weight, they're now looking for other options. I mean, prevention is better if you don't.
Absolutely.
How safe is bariatric surgeries? Especially among the Black, Asian, and ethnic minority groups. Do you see people coming that many?
Oh, yeah, I do.
Okay.
We see why there's a single number of people coming, and actually the numbers has increased as years. Yeah, bariatric surgery is safe. But before somebody has any kind of surgery, there's a preoperative assessment.
Yes.
In other words, the anesthetists goes through everything, look at their weight, blood pressure, and so many things to decide. Because even though it's so important for the person, regard it still as a quality of life surgery. To make sure that the person is safe before they have it. As you said earlier on, the most important thing is prevention. But if they get to needing bariatric surgery, because they'll be assessed, and if they do qualify, then they can have different kinds of bariatric surgery. There are ones where a balloon is put. A balloon is put within the stomach, so they can't eat as much in their stomach. Where the stomach is made smaller, they're different, or put a clip. So the whole aim is to eat, to force the person to eat smaller, or make them unable to eat more than they want. So they can only eat so much. And then over time, they begin to lose the weight. And obviously, when they have lost the weight and they have excessive folds, we can do a post-bariatric surgery where, like, the tummy tuck or the liposuction, trying to remove excess. But what we're encouraging people is try to prevent that from getting there. Something I noticed, like, amongst our people, they tend to say things like, this is the way we are.
Yes.
Which is not actually true.
It's not true.
One of the things that we use in the hospitals was called the BMI, the body mass index. And what it's actually measuring is how much fat does the person carry between a square meter of their height. So it's like, if somebody's like 6 feet tall and like 100 kg in height, so they're using their weight and dividing it by the square of their height. Or maybe their weight over their height, and whatever you get divided by the height again. But it's not true for everyone. If somebody is very athletic, like these muscular people, like boxers and everything, it may be wrong. The BMI may be high, but they're still very healthy.
That's still healthy, yes.
You know, because muscle actually weighs more than fat.
More than fat, yes.
Bone weighs more than fat, you know. But for those people, then all they can do is the waist circumference. Like for a man, any waist more than 37 inches, the person is at increased risk.
Yes.
More than 40 inches, high risk.
Okay.
For a woman, if it's 31.5 inches, increased risk, 37.5,
high risk.
High risk. So there are different ways to check and to see what is my waist like. Because we've already been noticed that people who carry a lot of waist or fat around their waist, then those kind of what they call obesity-related diseases are more. Yeah. So that's an indirect way of checking whether everything is right or not.
Yeah, I mean, the African community, the Asian community, and all other communities listening to you, you know, must be happy to hear you, you know, give advice like this, because they don't. It's not something common from their doctors. So one of the messages you've given here is prevention. I mean, yeah, we talked about bariatric surgery. No one wants to go through such a big operation if they can prevent it. And this is just from what they put in their mouth, isn't it? So now, yes, I know part of the output. You mentioned what they eat and the exercises. The exercises could be physical. Things like yoga. Does that, I mean, is that more of mental health, or because...
I don't think it burns much calories.
Yeah, isn't it?
It's more like strengthening the joints.
Yeah.
I don't do yoga myself, so I don't have any personal experience.
Okay.
But I think it's more like it doesn't burn as many calories. It's more like strengthening the joints and making the person more supple, and also is the mind as well.
Yes. And then in children, we have parents that feed their children Coca-Cola, and you know, from what you're saying, the parents should actually refrain. Or
all of us have to look at it. We have to take a second look at it about what we feed our kids, because the reason we don't notice as much sometimes in kids is that they have a lot of high metabolism. That's something we haven't even said. High metabolism burns the fat more. Yeah. Children are running about all the time. But if they carry on with that kind of wrong lifestyle, what happens is that when they become adults, they continue eating that way, then they pile up.
Yes.
For example, you look at footballers. During a match of 90 minutes, a footballer may run 13 miles, walking up and down. Footballers are so lean, but they eat like horses.
Right, okay. Yes.
But once they retire, and no more interactive football, watch them.
Right.
Because they're still used to eating the same amount of food. They just pile on the weights rapidly.
Yes.
You know. So again, it comes to mindset. We have to keep just re-educating ourselves and say, look, some of this damage we can prevent it ourselves by what we put in our mouth, by the activities that we do. It all starts in the mind.
Yes. Making
sure that the mind is right.
Yes. That is fantastic. It's a pleasure to have you, Mr. Fortunate Iwuagwu. You've done justice to this topic about nutrition and weight loss. Viewers, you've listened to the specialist, and I think the advice is try and prevent you piling up weight. Do anything you can to balance what you eat with what you burn out. If you've added more than you should, look at what you eat, do more exercises, and try and cut obviously cut down on what you eat and do more exercises so you can lose weight. You have to look after yourself and your family. It's been a pleasure, Mr. Iwuagwu, to listen to you, and I'm sure
Thank you very much.
Audience
My pleasure is mine.
Must have learned a lot from what you've said today. And viewers, we thank you for being part of Health Corner this week. Stay safe, stay healthy, and look after yourself and your family. Thank you for this week. Thank you.